but I try to control everything that I'm doing when it comes to my HIV as well as the pandemic.
Well, like any disease, living with HIV during a pandemic presents its challenges. Now, a clinic in the Big Bend is helping patients rebound. Why they say you shouldn't let COVID-19 stop you from testing and treatment.
The Rebound Tallahassee is sponsored by Perry & Young.
For years, I didn't even talk about it.
An HIV diagnosis is life-changing. This peer advocate for Big Bend Cares, who goes by Priscilla Parker, knows that firsthand.
I've been living with HIV since 1994.
And managing her own care year after year, she now helps other patients get the help and the support they need despite the pandemic.
We try to encourage those who want to be encouraged.
Wearing her mask, keeping her social distance, and depending on this temperature-taking station at the entrance. She's encouraging other patients to see their doctors regularly.
One of the things that we've tried to do during the pandemic is make sure our patients have an adequate supply of medications.
Dr. Jonathan Applebaum is with CarePoint Health and Wellness. He can prescribe medications thanks to advances in telehealth.
A lot of patients, especially those who are immunocompromised in any way, don't want to come into the office.
Visits via the internet solve that problem. For those who do have to visit in person,
we take temperatures, we ask questions, all of us are wearing masks, gloves. And patients aren't waiting in the waiting room for long periods of time.
While he and Parker adapt to treat current patients, they both say testing and knowing your status is crucial.
Knowing your status is very important because it keeps you healthy when you know.
Big Bend Cares serves about 2,000 HIV patients in our area. Another piece of advice from the doctor to everyone, he says get a flu shot this fall to be extra safe with the ongoing pandemic. I'm including a link to learn more about the services offered by Big Bend Cares with this story in the Rebound section of WTXL.TV.